97.9, 105.5 KISS FM. Listen, it's Liz, and in studio, it's time for the Slocum Dickson Medical Moment with the Slocum Dickson Medical Group, located on Burstone Road in New Hartford. Facebook and Twitter, sdmg.com for all of their information. I am so excited to introduce Dr. Hend Abdelwahab. Was that right? Did I do that right?
Yeah, perfect.
Okay, cool. So good morning. How are you?
Good morning. How are you?
I'm so good. And what I think is super important, you are a family practice physician. Let's talk about what are the most common women's health issues?
As a family practice, we should take care of preventative services and provide different counseling for women regarding many issues. And as a woman, there is a lot of concern, including mental health issue, general health issue like hypertension, heart disease, diabetes, the most important thing is a screening test for stuff like mammogram and pap smear, and that's specified for women's health itself. Yeah.
Right. You just touched a little bit about it, but like what screenings should women be thinking about and making sure that they are getting?
Yeah, it depends on different age category. You take care of women since age of during childhood, but as a woman starting from age 18 to like premenopausal, postmenopausal, childbearing period.
Right.
And so every age has a specific thing which is more important too.
Yeah.
Like for example, for a premenopausal woman, like a childbearing period, you have to provide counseling for preconception counseling. You provide whatever contraception needed. Screen for heart disease, diabetes, hypertension.
Right.
You can screen also for depression, stuff like this.
Yeah.
And starting from age 40, there is a lot of important thing like mammogram, which is the most important thing to take care of. Every woman is different.
Right.
Other thing like pap smear, which is screening for cervical cancer.
Right.
Starting age 21, pap smear. Depend what other risk factor can be. Decide how often and everything.
Yeah. I feel like a lot too. So you are a family practice physician and a primary care provider. Everybody should have a primary care provider.
Yeah, definitely.
And why should they, in your opinion, make sure that they have a primary care provider?
Primary care provider has opportunity to promote health preventive services and recommend different, different screening tests and everything.
Yeah.
And has a I will say like good relationship with their patient.
Yeah, that's a good way to say it.
They know the family, the whole family.
Yeah.
They have opportunity to build up a good relationship with the patient, to decrease their worries and encourage them to do stuff like this.
I think that totally makes sense. And if you do have a primary care provider, it's not as much of a, I guess, not a scary appointment, but for some people it is kind of daunting to go into the doctor's office for something, but it's just, a checkup, something routine, and maybe they mention something and you can help talk through things.
Yeah, like we talk about everything.
Yeah, right.
And most important thing, taking history from the patient, taking history from the woman.
Yeah.
You talk about all the health issue and all even social situation, the relationship, if they're exposed to any abuse, if they're misuse alcohol, smoking. So you talk about everything.
Yeah, you cover
as a woman.
Every aspect. Yeah. And when it comes to other protective measures, but also so you are a female doctor, and I'm sure having, female patients, making sure that they feel safe and secure and making sure that they feel taken care of is probably a big part of your job and why you like it.
They feel more comfortable talking to me.
Yeah.
Even some male do the same thing. It's because he told me woman doctor, listen more. You listen. Okay, that's fine. That's good. Yeah.
Right.
My job. Yeah. So.
Yeah.
So we talk about everything. There is no worries. I give the comfort for my patients so they can speak freely, they can talk freely whatever problem they have.
Yeah, and I love that. Slocum Dickson Medical Group. You can get all their details, Burstone Road in New Hartford, sdmg.com. Are you taking more new patients?
Yeah, definitely.
So make sure you're getting her information. I will link that on our website over at cmykiss.com. Thank you so much for coming in. This is a very important topic, and it's a good reminder for people to make sure that they go out there and they get checked and they also have the proper screenings.
Thank you very much.
Thank you.